Well, in less than a week, phase 2 of Governor Steve Bullock's plans to reopen the state will begin, and that plan includes thousands more COVID-19 tests. MTN's Annie Johnson reports on how likely that may be.
Earlier this week, Governor Bullock announced that he wants to ramp up COVID testing to 60,000 a month.
I think it can be possible if the state lab can do some of that testing. And from what I've heard, the overflow testing would be sent to a national reference lab. And there are issues with getting the swabs, but I think it's going to be possible over the next few months. I think they can do that.
But don't be alarmed. 60,000 tests does not mean 60,000 new cases. In fact, Dr. Nero says the correlation is decreasing.
Early on, the positive ratio of tests was maybe 10 to 20% and those were when we had the initial cases in March and April. But now the rate is much lower. It's much less than 1% because we're actually testing a lot of patients who are coming in for procedures to the hospital to make sure they don't have COVID to protect our staff.
Right now, the hospital is already contributing several thousands to that testing number.
And we can do up to 100 tests a day here in our lab on campus. And so that makes about 500 a week and up to about a couple thousand a month.
Which is progress from just a couple of months ago.
Early on, we had somewhat of a shortage in our testing supplies, but once we got up and running in mid-April, we weren't short on any testing supplies.
But as more testing becomes available, the doctor warns against using certain tests.
It's not very reliable in those at-home tests, so I wouldn't particularly use those. They haven't been well tested, or we use the term validated in a laboratory setting. We have the same test as the state lab, and it's a CDC assay.
For more information on the virus or testing, it's always a good idea to check out credible sources like the CDC website. Reporting at Bozeman Health, Annie Johnson, MTN News.